Off the top at 5, Omicron has been detected in 3 counties across Washington and in more than 20 countries all across the world. But some encouraging news about that variant tonight. Thanks for joining us for the news at 5. I'm Jamie Tompkins.
And I'm David Rose. Health experts now believe it may not be as severe as the Delta variant. A report from South Africa suggesting the strain could cause a milder infection. Local researchers are putting that information to use in protecting our communities.
Fox 13's Frankie Thompson joins us live from the newsroom tonight with more. Frankie?
Jamie, Washington is one of the top states in the country for genotype sampling throughout this pandemic. Local researchers say there is still so much unknown about Omicron, but they are already studying ways to best protect the community against COVID-19 variants.
The world is learning new information about the COVID-19 Omicron variant, but not much is known. Local researchers say the information currently available about this mutation has them on alert.
The people who are working on this are as frustrated as everybody. Seeing the data on the Omicron variant was like getting punched in the stomach. It was a terrible feeling when I first saw this and realized that it was real.
Dr. Joshua Schiffer with Fred Hutch in Seattle has been doing research since COVID was first discovered in Washington. He is working to predict how a potential wave of infection could impact King County. He says he's worried new cases could burden the healthcare system once again.
Even if it turns out to be a much more mild infection, if a huge percentage of the population gets infected, that can still lead to very big numbers in the hospital. So say the percentage of people who end up getting very, very sick goes down, but 30% of the people in King County get infected over the course of a month or two, that still has the potential to place an enormous burden on the healthcare system.
Scientists say Omicron is spreading at a rate approximately 4 times the rate of the Delta variant, even amongst those who are immune. Though research is still in the early stages, the variant has about 50 mutations.
The alarming thing is that we didn't see a lot of these mutations in related viruses. Usually viruses accumulate mutations over time, and so we can kind of track as mutations emerge, and we see more and more over time. But there was this gap, and as soon as Omicron was sequenced, all of these new mutations popped up. So there's a lot of questions going around as to how that happened.
With so many questions surrounding Omicron, Dr. Jesse Erasmus says vaccines are still proving to be the best defense against the virus. He says part of his new research at the University of Washington is evaluating Omicron variant-specific versions of the current vaccine.
A big question as to how we can design booster vaccines to better respond to these variants, but also how existing vaccines are able to protect against this particular variant.
In countries like South Africa, where Omicron was first detected, hospitalizations among children are increasing, an increase yet to be tracked in the States. Still, here in Washington, Seattle Children's Hospital is closely watching. The hospital says it will be important to see the data over time to determine if this finding persists. For those who can be vaccinated and/or boosted, it's important to do that now.
Researchers say the next couple of weeks will be critical in learning new information about Omicron. They predict the numbers of those infected with the variant will increase, but say they don't know how severe the illness will be.